Hello everyone, Doc Jadam here from the UP College of Medicine. In this instructional video, I make use of my CPR module for medical students, which I have delivered on a face-to-face basis for the past several years. At the get-go, I will make mention that you're in for a triple treat, as I share not only remote learning strategies, but also personal teaching tips, as well as key concepts that will allow you to successfully perform CPR. Yes, you will learn to perform CPR. If babies can do it, why can't you? So let's begin. Spending the next 3 minutes watching this learning video on CPR can help you save someone else's life. CPR should be basic competency for all adults, most especially those in the healthcare professions. By the end of this session, hopefully you will be able to answer the why, the what, and the how. Why is it important to learn CPR? What are the steps? And how do we perform the maneuvers? For this particular session, we focus on adult CPR for out-of-hospital arrests. Let's start answering the question why. CPR in reality refers to cardiocerebral and pulmonary resuscitation, as the external compression of the chest keeps the heart beating in order for it to deliver oxygenated blood to vital organs such as your brain and your lungs. Cardiac arrest can happen anywhere, and anyone suspected of having cardiac arrest will need CPR. Majority of out-of-hospital cardiac arrests actually occur at home, and that is why every member of the household must learn CPR. Our best tool to improve survival from cardiac arrests is proper and timely education. By cascading the right CPR know-how, we can improve the arrest victim's chances of survival. In addition, early defibrillation using your AEDs or automated external defibrillators is crucial if we are to improve chances of survival. Why? Because most arrests are due to shockable rhythms. Historically, lay rescuers had been advised to remember just the 3 C's: check, call, and compress. Checking for scene safety and responsiveness, calling for immediate help, mentioning the AED, and compressing the victim's chest. Meanwhile, the pulse check was reserved for trained rescuers, as this step unnecessarily delays chest compressions in inexperienced hands. The advent of the COVID pandemic, however, has changed the way CPR is performed in consideration of the safety of the rescuer. Instead of just 3 C's, the steps had been expanded to incorporate 2 more C's. During this time, all rescuers are advised to check, call, cover, compress, and connect. We check for responsiveness at a safe distance, calling out to the victim and observing for signs of life. We call for help by alerting bystanders, activating the emergency response team, and asking for an AED. We cover oneself with a face mask and preferably with a face shield and gloves, then cover the victim's nose and mouth with cloth or mask. We compress hard and fast at a speed of 100 to 120 per minute, allowing enough chest recoil. And finally, we connect the AED, awaiting instructions to deliver the shock. Proper positioning is important in delivering effective and efficient chest compressions. You straddle the victim's shoulder line between your 2 legs, interlock your hands, then establish a perpendicular orientation between your arms and the victim's chest. Push hard and fast to make sure there is adequate compression as well as chest recoil. Once again, a speed of 100 to 120 per minute is desired. Early defibrillation is crucial, as many arrest victims will likely have shockable rhythms. Remember AED when operating it. Attach the pads, evaluate the rhythm, and deliver the shock when needed. By this time, we should already have addressed our learning objectives, making sure we know how to recognize the arrest, where it happens, and why CPR is important. Remember, CPR is easy and life-saving. All you need is the heart to care enough, a clear head to know what to do, and steady hands to deliver the life-sustaining compressions.